If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. I started wondering if an individual's health can have larger effects on their community, then isn't all health public health? And what does this mean when we think about rebuilding healthcare with tech? In this episode, Digital Health Review speaks with Alessandro Ciari from CUNY School of Public Health about social impact, innovation, and why public health needs digital health and digital health needs public health in order for each to succeed. Alessandro is an assistant director at the CUNY School of Public Health and has spent his career leading NYC-based sustainability policy initiatives and supporting businesses to scale for public health impact. Let's get started.
And I knew I always wanted to go back to do a public health degree. I did that. And while I was there, met Dr. Terry Huang, who was really interested in developing an innovation and entrepreneurship platform for public health professionals to get that experience that I got from going from a public health practitioner to entering a mindset of an entrepreneur. And so if you're able to combine those two fields of thought, there is so much potential to be done with that, especially as we look into the intergenerational transfer of wealth going forward. People want to spend their money on things that is actually going to contribute to a sustainable society, a sustainable ecosystem. And that includes proper public health investment. Now, I was really lucky to be introduced to a startup coming out of college that was just really interested in reducing waste. And I was really interested in the idea too. We started to actually develop this startup with a company that already had a little bit of experience with this type of thing. So I did research, market research, to understand the validity of this type of waste saving innovation to implement within a larger business and organization, and did this in a way that was more entrepreneurial as opposed to doing it as an employee of the company. And through this process, I actually entered an accelerator as well that was offered by NYU. And then I was exposed to the realities of what an entrepreneur goes through for the first time, and went through the reality of what you have to prepare for before engaging in your research or your implementation of whatever you want to do. Before doing that, you have to consider doing these other aspects and consider doing it in a way that is going to be actually successful. And so that really opened up my mind a lot, opened up my eyes.
Tell me about the program. How did it get started? Why did you do it?
Yeah, at the CUNY School of Public Health, we started running this program called Firefly Innovations, based
Mm-hmm.
on the need to really bring more innovation to the field of public health. There is so much amazing research and education and programmatic work that is done through the public health institutions, whether it's government based or in academia like CUNY. However, there's a large gap in trying to turn a lot of our research, the valuable work that we do, into sustainable and scalable organizations. And you're seeing so many amazing startups out there, so many interesting businesses and other nonprofit organizations too, that are really creating a social impact, and particularly a public health impact. For example, looking at COVID-19, how many mental health apps and platforms and forms of education have come from that, from so much innovation, from tech development, from organizational growth and innovation. And that's what public health needs. Entering the 2020s, this is a way for public health to really expand as a field And so Firefly Innovations was started by Dr. Terry Huang at the CUNY School of Public Health. And I was lucky enough for him to bring me on board to make this happen, which is really a platform to bring together entrepreneurs in public health and to bring together researchers, academics, and others within the field of public health that are looking to create that type of innovative impact and really help create and scale and sustain organizations that will make a real change. And again, thank you so much for engaging with this type of platform.
Yeah, absolutely. I mean, that's the community, right? That's the community that I'm a part of, that I believe in, that Digital Health Review is a part of and believes in. You touched on a lot of ideas around unity, intersectionality, um,
Yeah,
as well as transparency, and communication. And then, of course, how that all affects how we're building things and considering things like social determinants of health, uh, and how we can use technology to work together, which I think is fundamental, resonated with me. Happy to have participated in the Designathon. So happy to have met you. And the other minds that were there were also just fabulous, and just getting stimulated again about uh, all of the possibilities that are out there to help with these solutions. And there just seems to be in the air uh, hope, just
yeah.
hope of what we can still do, that like actually we can make this better, actually we can do it. And I
But
love
that's what we
feeling
need. Yeah.
exactly actually needed that round. And so, yeah, I think there is some intersectionality with digital health and public health and policy regulations, data, the folks that are financing this, right? And their part and stake in it. The
Hmm.
patients or ourselves, the consumers, right? Who are using these tools, how can we have that language formed, and how can we work together is the question, is the big question, right? So I'm curious because
Yeah.
I'm coming at this from a digital health perspective. Uh,
Hmm.
I'm coming at this from a tech data nerd, build, of design thinking, innovation thinking perspective. And I'm learning about public health in this process. It's probably my next degree, unfortunately. Um, um, it's my next degree for the very reason of how powerful that it is. So, what got you started in public health and policy work?
Yeah, great points. And, definitely that's what we're aiming for is bringing minds like yours into the field of public health and bringing more minds of public health to the field of digital health. That is thinking more innovatively and see how we can use the values and the pillars of public health for the benefit of furthering our tech innovation, for disrupting aspects of our society that needs to be changed. And so, when I actually started doing public health, I had no background in public health. My family are all artists, and I went into a career of trying to do things within theater and film, and that was going well. But once I was in college and started to take some other classes outside of um, areas that was more comfortable with, I started to learn a lot more about why things are in society. Once you start taking public health classes, you really start to learn about why so many policies are the way that they are, why education the way it is, why so many systems serve the way that they do. And by being able to finally understand and define these different aspects of our society through the really holistic lens of public health professionals, professors, individuals, then you could actually start to design programs to actually address the challenges that have really plagued us, plagued myself, my whole life. And the first thing I did was actually work on developing an environmental program was focused on sustainability, focused on increasing access to clean tap water that's public. And this was in New Jersey. And that's when I realized the power of community organization around a particular public health challenge. If you bring people together to focus on a particular challenge, there are people that are going to identify with you and people that are emboldened, empowered enough to actually voice their opinion and do something about it. And so through that experience of actually engaging with starting my own program at school, starting to work with organizations around advocacy around clean water, that really, really springboarded my understanding of how to create social impact in our systems, how to network properly around that. Now, what I didn't have was an understanding of how to actually scale that and turn that into something that can become a really sustainable and scalable organization, something that you don't really learn too much about in public health or in any other kind of field. In fact, you're typically scared off by it. It's something that's really intimidating and something that seems very overwhelming.
A lot of what you said, it's true. It's sort of these experiences that we have that touch other worlds, and we take what we've learned and we put it underneath the lens of that new place that we're discovering. And there's a whole new reality, right? Um, and everyone can have those sort of concentric moments of looking at something from a new lens. And that's why I love interdisciplinary education. I've always searched degrees for that. And it made me think of, the folks that are told not to shy away from the finances and how to start a company are MBAers,
Hmm.
engineering schools are, those sort of design thinking um, degrees and disciplinaries that folks who are starting these tech companies come from. And so I think it would be like I think you're right that it would behoove both of those communities to get a little bit closer together. Curious though, beyond that, what else do you see is hindering or is a challenge for the whole public health community right now?
What is a challenge for the public health community is, well, you really have to look at which challenge particularly. There's so many different types, and one way to really consolidate the different types of challenges that we do focus on is to think about the Sustainable Development Goals internationally. And this spans from reducing poverty to innovation in our communities, to clean water, to life on our planet. This is something that, public health definitely cuts across every single one of these challenges. And I can't ever say that one has a higher priority than the other. Challenges are always going to be there, and we always need people to focus on these challenges. And it's not going to be done in a centralized manner. Every organization should be focused enough on different challenges so that they could actually make an impact on it and trust for other sectors to be able to develop solutions for their challenges that they face as well. So for us, we look at the CUNY, if you're looking at the CUNY School of Public Health, we're the largest urban university in the world. We have the most diverse base of students than even for staff and researchers in the world. And we're a very, very large institution, 26 different colleges. But there's an underline on urban. We face certain challenges here that may not completely apply to other challenges that rural communities may face, but there are certainly systemic repercussions based on what both of them do, and there will be effects on each other's cities. And so, what we look at here, and especially if you're looking at past COVID, this is something that it seems like our communities are always in front of the ball, seemingly like we've got this under control. But then next thing you know, it slips out of our hands and people blame public health institutions, blame education institutions and others about how we're dealing with COVID-19 and other viruses that are coming up from that and could be related to that and also contribute to our overall anxiety in a place like New York City. So one of the largest faces the problems that we face here is really understanding how to be in front of the ball when communicating with our communities about what to do with the virus and how to prevent the virus and how to actually engage in other types of volunteerism, organizational development, entrepreneurship to develop solutions for this. Because it's not going to be done by the government only. It's not going to be done by CUNY or these larger organizations or businesses or Amazon can only send you so many things. We need our own decentralized local innovation solutions to be able to address issues like COVID-19, and we need it to be more tailored, more personalized for what everybody needs. So if you look at something like digital health review, you're actually already starting to address a major challenge that we have, which is one, communicating with our communities that actually want to listen about a particular challenge that we're always going to have to speak about. It's actually being able to access medical professionals that are culturally competent. And that's something that we're experiencing a deficiency of in our whole public health system and our health system beyond that, the private healthcare system as well. Something that we need more of. And we're experiencing that in the result of the health disparities that show itself in the results of COVID-19. I mean, still till today, African Americans, Latinos, Asian communities as well are experiencing worse outcomes compared to white counterparts. Now, why is that the case? And cultural competence can be one of the types of approaches that we can take to all of our tech and innovation to be able to really take hold of this type of challenge.
Absolutely. I agree with you that it will not be a centralized solution. No one community is going to be able to solve for these issues on their own. And I do believe something that you said was very foundational is communication, right? So how can we communicate better within our communities, across communities, to the general non-healthcare community, especially when we're talking about humongous impacts like COVID or other public health concerns. And that is a weak point that I think that
Yeah.
we should be acknowledging if we're not doing so wholeheartedly, and not in a way to just acknowledge and then cower, but to use that as a point of excitement and say, okay, great. This is the new problem that we need to fix on. We need to be able to fix how we communicate so that we can get the right message out so that we can see action. And that's really important. And I think that's a skill that is, everyone is working on all the time. And so there's no shame in that. And it's something that the healthcare system is also struggling with, not just the public announcements and how we've educated folks about what to do with the virus and how to think about it, but also just communicating internally.
Yeah.
It still is a lot of pieces, literally hardware, software, people, locations that are intertwined into the healthcare system. And so a lot of communication is needed, and steps have been made to get there. And minds have been put together to try and solve it. But I'm curious, do you think that tech companies can create an impact for these types of challenges like communication?
Without a doubt. And it's actually very much reliant on technology to be able to do that. It seems like with public health, it can be a little bit behind with things. As we all understand, the government can be slow, institutions can be slow moving, and we need private organizations. We need rapid R&D to be able to really test and prototype and implement new types of forms of communications. And we're not always going to be able to do that through our system of the grant-based mechanisms or research like that. Like, yes, that definitely serves its own purpose, but there are other players within our ecosystem that can conduct this type of research and actually implement new forms of communication. And it's in a, there's definitely, if you're looking at something like digital health review, it is something that you may not actually reach the end result of how it's going to actually be implemented in society, how it's actually going to be like uptake by society, how it's going to be used, unless you go through so much of the tribulations and trials and pains and errors and growth that you go through as an entrepreneur, as opposed to being a researcher in an academic institution. And so those folks in digital health may actually be able to really further our capacity and our efficiency because of the work that they do in tech development. And so we're all very much reliant on each other as systems, and digital health certainly may serve the largest role in trying to figure out ways to improve the ways we communicate health importance and guidelines, and the way that we try to change health behaviors ultimately, so that we can take a prevention-based approach to improve public health outcomes.
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.